afternoon, everybody. I hope that this is live. It is Saturday, November the 7th, 2020, and my name is Lizette. I am an occupational therapist, and I'm also a dementia specialist, and my love and my passion is working with people with dementia. And so I am here this afternoon to kind of talk to you guys a little bit about dementia and all things dementia related. I answer questions online. My name is Lizette. I'm an occupational therapist and a dementia specialist, and this is going live in the Alzheimer's and Dementia Support Group, as well as I'm trying something today in my own little group called Think Different Dementia. I'm hoping that it is actually going to be streaming in both. I'm not sure that I can actually see the comments in both groups, so I'm just going to stick with the bigger group for right now called Alzheimer's Dementia and Support Group for any live questions. And to start off this afternoon, how was everybody's week? It has been a busy week for me. I was up in New Hampshire last week. I had a wonderful time. My sister was running for election up in the state senate in New Hampshire, and I was extremely blessed to meet somebody from one of these groups. Actually, I think she's in both of the groups, by the name of Lori. She took the time and the effort to actually come and meet me while I was doing a sine wave for my sister at one of her polling stations on Tuesday. So I felt extremely blessed about having that happen. She was very generous to me. She gave me a gift. It just absolutely blew my mind and made my day. So thank you, Lori. Thank you tremendously from the bottom of my heart. I really do say thank you. If somebody out there in Facebook world can just throw me a comment to let me know that it is actually going out live, that would be wonderful. Usually I do pretty good with that, and I love being here. So yet again, the Alzheimer's and Dementia Support Group and Think Different Dementia. So my name is Lizette, and I'm going to throw my information out there. If you want to reach, if you want to reach me, you can email me at this. Great, Paul. Thank you. From South Carolina. Think Different Dementia at There's my email address. If anybody ever wants to email me, you're free to do that. And Emma's on, and Paul is on. So I usually start off the Saturday. I put a post up on the week just to make sure that I don't get into the same situation that I did the last time when I ran out of comments and questions, and that was a little nerve-wracking, so to be honest. Hey Elmarie, hoe gaan het? Dit is baie warm hier by ons. Ek dink dit raak seker by julle ook warm. Elmarie looks like she is from South Africa, and based off of her name, I would guess that she speaks Afrikaans. So to start with, I'm actually going to answer a question from Moira. Moira and I have really been dialoguing a lot over the last little bit, and I'm excited because this is exactly what I want people to do. Okay, so Moira wanted to know, what was the usefulness of occupational therapy assessments? And so I thought that was really kind of great because I am an occupational therapist, and like all therapists in various different fields, physical therapy, occupational therapy, speech therapy, we all have different types of assessments. But just like life and life in general, we are, not all good with different things. So some of us specialize in dementia, some of us specialize in physical disabilities or shoulders or things like that. So Moira, in the case of people with dementia, occupational therapy, you would really want to have somebody who is specialized in dementia care when you go to an occupational therapist. We're not all made the same. We don't all have the same interests. And so occupational therapy in the specific domain, if you want to call it that, of dementia care or anything regarding thinking processes we are like me. What I do is I look at the whole person in their environment. I look at their home setup. So if I get a patient or somebody that I'm working with at home, I work in home health still. I go into the house. The first thing that I look at is the environment set up for that person. So what I mean by that is, can they get in the bathroom? Do they have the right equipment? Do they need a shower chair? Do they need handheld equipment? Do they need other kinds of things? Do they need a hospital bed? I look at the environment, because if the environment is set up for the person, then we can get them to be a lot more independent at home. So that's the first thing that I do. The second thing that I do is I frequently, probably with most, if not all of my patients, I do a quick little screening, a cognitive screening. It's not an evaluation, but it does get me into the ballpark of, does this person potentially have thinking problems or not? It is 6 questions. It is standardized. And it is a down and dirty assessment. It is not a full-blown evaluation. It's just a down and dirty. 0 to 4 on this scale means the person has normal thinking processes. Between 5 and 9 on this scale means maybe something's wrong, maybe something's not wrong. And then 10 and below indicates, Houston, there's a problem. We have an issue. So occupational therapy, like I said, I do that. And then if I notice that they have questionable cognition, or if they are testing in the dementia range, I will actually go ahead and do another assessment. I will do an actual thinking processes assessment. And so the benefit and the usefulness of occupational therapy in the particulars of somebody with dementia really is going to be related to what phase of dementia. Hey, Nishita, I will be with you in a second, because I actually have your question on here, and I will be answering that for you here in a second. But back to occupational therapy for people with dementia, it's going to depend on their level of cognitive abilities. And so with people with dementia, if there's still, some people with dementia still have the ability to learn new information. So if they have the ability to learn new information, I'm actually working with that particular individual to try to make sure that I've taught them everything that they need to know. If they're at a point where they cannot learn new information anymore, then really the emphasis switches over to being able to teach the care provider what they need to do with this person. I look at whether they can bathe themselves. I look at how, what the best type of cues would be to give to the person. I look at trying to work with the physical therapists if it is somebody who right now needs a walker, but probably in the future is going to always need a walker. Let's not try to take it away from them. Let's try to keep it routine and familiar. So there are lots of different things that we do as occupational therapists. But just like in any field, you have good therapists and you have people who can do the basics. When you are working with people with dementia, trying to find somebody who is a person who specializes with cognition, I think makes a tremendous difference. And once you've found that person, try to keep working with them. I do private consulting too, so if anybody ever needs that, please reach out. And so, yeah, that's where we're going to go. So that was Moira's question. So I'm gonna go back to Nishita, which I probably am totally butchering her name, but that's okay. Nishita is in India, and she wants to know why some people seem so happy and placid while others are so angry and annoyed all the time. That is a great question. I honestly struggle with that because I believe people are all created in the image of God, and that inherently we are all sinners, and that we are going to show what's in our heart. I've had people who were pastors their whole entire lives, who nothing came out of their mouth. They never would have cussed a day in their life, but everything after the dementia coming out of their mouth is foul and ugly and nasty. I don't know why. I've had people who have been cussing up a storm their whole entire life and not nice people by everybody's description. With dementia, they become a lot more placid and calm and so on. One of the early signs of dementia is actually a change in personality. So we all have personality, and most of the time our personality is located like in the frontal lobe of the brain that controls our emotions. And so when you have people who have dementia, one of the things that people have trouble with is what's called executive functioning. So executive functioning really is things like time regulation, working memory, short-term memory, reconstitution of information. There are a whole bunch of different things that fall under executive functioning: planning, organization, sequencing, higher level things. Well, one of them is emotional regulation. So to me, it would make sense that when we start to lose our ability to emotionally regulate our abilities, that is why we see these wide swings. People who have the ability to, people who don't have trouble with their thinking, and not just people who have trouble with their thinking, but like a lot of people struggle with emotional regulation. People with autism, people with head injuries, people with concussive syndromes, PTSD, Asperger's. There are all of these different kinds of things, schizophrenia, that people struggle with emotional regulation as well, or executive functioning. So it's not just people with dementia. So emotional regulation, Nishita, is the ability to be able to control our own emotions from the inside. We don't let things going on the outside affect us, or not that much. They're not these super highs and super lows, super highs and super lows. Well, when we lose the ability to control our own emotions, the things on the outside, the things that are happening to us, the election, or I didn't sleep well, or there's noise in the room, or I'm hurting because I haven't been positioned or changed, I'm sitting in dirty britches, well, lots of different things from the outside, family arguing, all of those kinds of things, because the influences are coming from the outside of the person, and they respond to that. They go all the way up and down, and they cannot control their emotions. So I would say that would be why some people are happy and some people are not happy all the time. And really, honestly, a lot of our people with cognitive impairment, with dementia, they are very keen in sensing our emotions, the people who are working with them and caring for them. So if they are very frustrated, if I'm frustrated or anxious as a caregiver, and I go in and try to work with that person, and I'm rushing to try and get through my job, then I make them anxious and frustrated and annoyed. So anybody who is on here, if you guys have questions, I would love to hear your questions. I do have a few more questions on here that I'm going to go through, but I just wanted to make sure that there aren't any specific other questions out there. Eunice, how's Mom? Shoot me a message in there and let me know. And hi, Marcy from Oregon. And then we have Paul, who is from South Jersey, just outside of Philadelphia. We drove around Philadelphia last week. We decided not to go through. I don't like the traffic. So, and then I have here was another question. So anybody who's on here live, please ask your questions. If I don't get questions from you guys, then I'll just keep rambling, and that could be a very long hour. So I had another question on one of the earlier posts by Marianne. She asked, what can I do to advise her about her husband? He always took care of himself, especially his appearance. He still takes care of himself somewhat, but won't get into a shower every day. Sometimes it's every 3 days. He doesn't change his clothes and would wear the same thing the next day. And if I didn't, if she doesn't throw them in the hamper, he would wear them again. so she keeps an eye on it and makes sure that he is changing his clothes. She says sometimes he brushes his teeth without toothpaste, and she doesn't want to keep harping on him as he gets mad and makes suggestions, and she knows it's the dementia. She tries to stay calm, but doesn't want him being dirty or to smell if he can still take care of himself somewhat. So this is absolutely such a great question, Marianne. So as people start to change because of their dementia, and if we just go back to looking at the executive functioning, executive functioning includes planning and organizing and sequencing and time regulation and all of these what we call higher level skills. So our ability to problem solve and sequence things starts to become affected by dementia. The things that stay highly retained are the routine and familiar things, the things that we have looked at, that we've been doing all the way from birth on. I've been doing some research and getting ready for a presentation that I'm going to be doing in February next year. And so I re-looked at the FAST. It's a functional assessment. Now I can't remember the name of it entirely. Let me pull my book out here because I'm a nerd, and I have books. All right, so the FAST is actually, where is the name of it? It's right here. All right, give me a second. So we have, it was designed by Barry Reisenberg, and it is very sensitive to what's known as retrogenesis, meaning going back to birth. So we all know people who have developed from being a baby, moving on and developing through to the higher level stages. Well, when we hit about between the ages of 12 and 16 to 20 years old, we are starting to develop our executive functioning. And so our executive functioning actually continues to develop all the way through the age of 25, which is why insurance rates are so high for people under 25, because they are not necessarily anticipating the consequences, etc. So back to the question Marianne asked about her husband who doesn't want to shower every day and is not putting his toothpaste on his toothbrush and so on. What's happening at that point is he's probably already in like a moderate dementia phase where the routine and familiar stuff is starting to fall apart. He still recognizes a toothbrush because he's using it, but he's not actually using all of the sequences, the right sequences in doing things. So for example, when we're problem solving or we're planning things or we're organizing things, we know step by step, right? Pick up the toothbrush, take your toothpaste, open it, put your toothpaste on. Some people run the water first, wet the toothbrush. We've got little differences. Run some water on, we brush our teeth, we spit. These are all the steps, right? So as people start to lose the familiar steps, they need step-by-step cueing. They need somebody to say, here, it's time to put on the toothpaste, or get it all ready for him. Put the toothpaste on and have it laying there so all he has to do is brush his teeth. So as people progress through the stages of dementia, they will start to lose the ability to plan and sequence these very basic things. That's why they get to the point where they stop scanning their environment, which is what I'm thinking happens with his clothing, right? So he's not necessarily scanning the environment to say, oh, there's the closet, let me go to the closet, open up the closet, get my clothes, pick out the right clothes for the season and the situation and put them on. He takes his clothes off at night, he throws them there in the morning when he gets up, oh, they're clothes, let me put them back on again. So he doesn't remember that he wore those clothes the previous day, and he doesn't have the ability to look to the future or scan the environment and open up and find the right clothing. So as people, yes, I understand you don't want to keep harping on him, but maybe just try to use different words. Here, I've got this ready for you. Here, let's do it this way. Or here is, let's do this together, or just kind of help him sequence it through. Regarding the clothing, I think you're doing the right thing. Just set it out and every day. And then regarding the showers, if you got to pick your battles. You got to decide, what is the most important for you. So I would start with just maybe making sure if he doesn't smell, just make sure he's clean in between. Maybe remind him every day and say, get everything ready. Hey, it's time to go take a shower, and just take him in and help sequence him through that. So I hope that was helpful. So we have a couple questions on here now. Hi, Lori. There was another question of you here. I would be happy to answer. I'm going to answer them both. Okay, I'm going to start with the one from the other day where you asked, in later stages, do they experience anxiety and mental anguish? What are they thinking and how do they feel? And how can we help? You sing to your husband, you pray, you tell him he's a wonderful person. Those are exactly the right things to do. A lot of people with dementia do have anxiety, but not everybody with dementia has anxiety. I think there's so many different things that happen through people's lives, and because we don't always know what happened in people's lives that they're returning to, I think that's sometimes where some of the anxiety can come from. I also think some of the anxiety comes from sensing that something's not right, and having a fear because they don't necessarily understand or know what's going on. So constant reassurance, I think, is important. I don't know what people with dementia are thinking. I think people with dementia feel a variety of different emotions, just like we do. I think that all behavior that we see with dementia is related to trying to communicate something. We're made to communicate right from the time we're babies. The first thing that we do, we start to communicate with our mothers in utero, right? When babies are given music to listen to, they'll kick, or if you push on a pregnant belly where the baby's kicking, they'll kick. So we are designed from birth to communicate with people, and we are, when babies are crying, when they are hungry and dirty and things like that, they're trying to communicate something. So people with dementia, when they start to exhibit behaviors, or when they're showing negative behaviors can be positive and negative, crying or whatever, yelling, biting, throwing things, all of these things, they're trying to communicate something. And so our job is to try to figure out what is going on. It doesn't help asking the person, what's making them worry. But I mean, if they're nonverbal, are they constipated? Are they hurting? Are they in pain? Do they have a urinary tract infection that's not been picked up? There's so many. We have to be the detective. We've got to figure out what's going on. Look at what happened before. Be a dementia detective is another way of looking at it. Write things down. See if you can track a trend, because everything that they do, they're trying to tell us something, and it's up to us to figure out what it is that they are trying to tell you. Lori's other question was, what stage would it be when a person puts their shoes on the wrong foot? Based off of what I'm hearing from you, your husband would probably be in a moderate to starting to get to a severe phase of dementia. There's certainly tests that I'm happy to help you with if you wanted to get a closer look or a sense of exactly where he's at, and if you want to, just reach out to me and we can talk about doing that. So Tamsin said, I have heard so often when asking about types of progression for dementia, everyone is different. Yes, everyone is different, but to a large extent it follows a fairly consistent change. And I've heard people say, frontotemporal dementia, or this type of dementia or Lewy body dementia, etc., that they don't all show the same signs and symptoms, but to a large extent, people do, in my experience, and a lot of times, you got to remember, Alzheimer's per se, Alzheimer's dementia is the umbrella term, but Alzheimer's dementia is only right now diagnosed on autopsies. So all we really have to work with dementia in general is looking at which part of the brain seems to be affected, or on an MRI or on a CAT scan we see atrophy, or we see certain atrophies in certain parts of the brain, or we see certain behaviors or things like that. But to a large extent, a lot of people have more than one type of dementia going on. They may have Alzheimer's and a vascular dementia, or frontotemporal dementia and a vascular dementia. There's a lot of mixed pictures. But in my experience working with people with dementia, even though every person is different, they all somewhat do follow the same progression or regression back, and really very much follow going back through the stages, which is why I think the FAST scale, and why I think that one's helpful, because it looks at how people are slowly losing their abilities as they're going backwards. So yes, everybody is different, but there are a lot of similarities regardless, and a lot of the tricks that you learn for one type of dementia works for the other kind. I do think it's helpful to know what stage a person is. I do think it's helpful to know kind of what type of dementia it is. But really, mostly with dementia, what are we doing? We're trying to keep the person at the highest level of ability to function, and we're trying to communicate with them and keep them as safe as possible. So, those are just my thoughts, but I'm going to keep going here. Paul said, as you go through this path with a loved one and meet more and more people along the same path, I've learned everybody's situation is different and unique, and at the same time I found that in every situation they all do or begin to act the same way. I found that in such as not bathing, wearing the same clothes for a day, they all adopt similar, if not same, traits, if you will. Do you feel? Yes. And I think that's why I like the FAST scale, Paul, because it goes, so the FAST scale, which I never came up with the name, here it is, Functional Assessment Staging Tool, uses a retrogenesis model. So we all develop the same way, right? We're born, we breathe, we make eye contact, we roll, we sit up against gravity, we start to crawl, we come up against gravity, we start to walk, we start to feed ourselves. Everybody develops sort of kind of in the same sequence to a large extent. Yes, some people start to walk when they're 8 months old, some people start to walk when they're 16 months old. So there's a spectrum, right? But we all kind of go through the same development phases, all the way through to 3 to 4 years old, managing our bowel and bladder, being able to dress like a 3-year-old. You can tell a 3-year-old, go get your clothes and go get dressed, but they may not come back with the right clothing to go to church. They may come back with the same clothes they wore yesterday, right? So we all, when we're developing through our stages of development, we all follow these certain traits. When we hit about, from about 12 on is when we start to develop our executive functioning. And as I said earlier, it goes all the way on to 25. And it's those higher level skills of the executive functioning. And I've used this analogy before. If you think about our brain as an onion, the executive functioning is the outer layers, right? It's the stuff that we do, the planning, the forethought, the sequencing, the organization, reconstitution of information, working memory. There are a few others, time management, time regulation, right? So those are the higher level functions. So when a person starts to lose those higher level functions, what remains underneath are then the highly retained skills that we all have for bathing, dressing, grooming, etc., etc. So I do find that model that uses the developmental stages going backwards to be a very helpful thing to kind of see, because each person, though they're different, but the reasons why they show the same changes are the same. You know, why do people stop bathing themselves? It's because they cannot plan anymore. They cannot sequence it anymore. They cannot anticipate the consequences of it. Well, when we have a 2 or 3 year old, we got to tell them every day to go take a bath. We got to physically help them take a bath. We might give them the washcloth and they wash their face. We may say, wash your arms, wash your privates, you know, let's get out, let's rinse off, right? We step by step tell them what to do. And so, yeah, using those phases of development really helps people understand what's happening. So yes, I think those were some really, really great questions. So Carrie Ann asked me a question earlier this week, and Marge asked the same question, and I actually had to go look it up. So the question was, why do their noses run? And I sat there when I got this question, and I would love other people's feedback if you have other ideas or so on. I am going to tell you, I actually literally had to go Google search this. So nope, I don't know everything. I definitely don't know everything. A couple of things came out as I was looking at that. I think people's nose run for a variety of reasons. Number one of the things that came out on the Google search was medication. Sometimes medication for dementia actually can cause rhinitis or allergies, right? And a runny nose can be a sign of that, or it is a side effect of some of the medication that people take for dementia. A runny nose and watering eyes can be side effects of medication. I think that there's a more, other than allergies, have they moved environments? Were they prone to allergies beforehand in their life? There's older people start to develop allergies. Have they moved from one environment to a next, and now there's an external allergen that they didn't have before they moved in with you? They never had animals, now there are animals in the house. Those kinds of things are just the practical things that literally jumped out at me about a runny nose. Now something else, and I have no science to back this other than experience and knowing people and having worked with thousands and thousands of people over almost 30 years, is if you think about little kids too, right? Back to what we were talking about earlier today, going through the retrogenesis, the phases of going backwards, right? An 18-month-old child up to the age of 3 to 4, they don't always blow their nose. They don't always sniff to get the snot back in, right? They will sit there and it'll stream out of their noses because they're not thinking about managing their own secretions or managing, being able to. Why do people drool, right? They lose the ability to manage their own secretions. They don't swallow enough. Well, I think when I know when I have an allergy, my nose streams, literally just runs out, right? But as that allergy clears up and I'm not at that point anymore, what do? I blow my nose, or I sniff to get it back in when it starts to run out. An experience I'm having a lot of lately is right now with COVID, right? I get to wear a mask when I go to work. And sometimes, your nose starts to run inside your mask. It's hot and it's awful. And so what do? You just kind of try to sniff it up until you're done. So I think that part of that has to do with allergies, and part of it has to do with the fact that they really just are not managing their own secretions well. Either blinking enough. People when your eyes start to water, now my eyes are watering just talking about this, but your eyes start to water when you don't blink enough too, because you'll get stuff in your eyes. So I think as they're not thinking clearly, and they're not planning, and they're not, everything starts to slow down. I think that's part of the reason why. So, yep. It is a side effect. Yep, we talked about that at the beginning, right? And it's also a side effect of some of the medications too. So let's see. Yep, dementia also makes your noses run. Totally. Hi, Laura. Thank you for coming back on again. We do need to touch base. I still haven't. I had a crazy, crazy week. So anybody else have any more questions? I'd love for you guys to ask some questions on there. As I've got only one more question over here. So Faith asked me yesterday, how do you convince somebody you suspect of having Lewy body dementia to seek help when they truly believe what they're seeing? So I asked Faith a few more follow-up questions last night because she happened to be online and I happened to be online. I don't remember if she ever answered why she thought they specifically had Lewy body dementia, but a little bit of background regarding this, and I'm just going to use some general terms. She was asking about her mom's mom, who lives next door to her mother. Her mom's mom is 74 years old and is now starting to have some trouble with things that they are seeing, that she thinks that she believes some things that aren't there, and she thinks that she has Lewy body dementia. I don't know that she has an absolute diagnosis of Lewy body dementia, but as to the more general question, how do you convince somebody to seek help when they don't believe that they need help? Well, that is a very difficult thing to do. Unfortunately, at the beginning stages sometimes of dementia, it is very difficult to convince an adult to do something that they don't want to do. And unfortunately, sometimes at this phase, the only thing you can truly do is keep the person safe. It does not help, and Laura can maybe help me with this too, it does not help trying to argue with somebody with dementia or anybody who's having a hallucination that what they're seeing or a delusion. It doesn't help trying to reason with them and tell them that it's not true. They are truly believing that it is going true. And I'm not talking about a psychiatric disorder where, you're working on trying to get people back into a work situation and so on, where delusions and hallucinations are a different conversation. But somebody who is truly hallucinating because of some sort of a dementia, or having a delusion because of some sort of a dementia, my experience has taught me to ask a few questions. Oftentimes these are things that medication, if they're of a point where the person needs to be taken in for medication management over a longer period of time, like in a psychiatric, adult psychiatric unit or a dementia care unit where a psychiatrist can work with them on medication, etc. But those are hard stays to get people qualified for, and things need to be pretty bad before a person gets to that phase. But what I've found helpful over time is, asking, are they afraid? I hate having people be afraid. If they are afraid of what they're seeing, I think that's something that we need to do something about, because living in fear is a terrible way to live, and how anxious you would have to be if what you are seeing, what you truly believe that you are seeing, is scary to you. So I always ask them does this make it afraid? Yep. I also tell people, Laura added a comment that said, try to keep a log. I call it a dementia diary, and it helps me. It would help her. She's a nurse practitioner. Laura is a nurse practitioner. Prescribe things when it happens. And yes, if you could share that behavior log on here, that would be great. And I tell people all the time to diarize behavior, and the more detailed they can be, the better. I call it being a dementia detective. So yes, absolutely documenting what you can, as much as you can, really is helpful to people like Laura, who can prescribe medication. But from a practical perspective, if there are families, I work with a lot of families who do not want to have their loved one on medication. I have a dear friend from church whose mom lives with her. She's in her 90s, and we've talked about this. Her mom has a lot of hallucinations, and so we started with things like asking her mom to describe what was going on. Her mom sees people in the bedroom with her, and they frighten her. So we tried things like she would say, "Okay, Mom, where are they? Here, look, I'm walking them out of the room. Are they still in the room? No, they're not in the room. Okay, I've shut the door. The visitors are gone." And sometimes that has helped people with hallucinations. Sometimes they see bugs. I ask them, "Do the bugs scare them?" They say no. Then I'm like, "Okay, well." They'll say to me, "Well, they're there on the floor." I'm like, "Would you want me to step on it?" And I'll go ahead and I'm like, step on the bug, and I'm like, "Did I get it?" And they'll say yes or no, and then I'll keep doing this. So there are lots of different ways to kind of help people when they truly are having some hallucinations. But regarding convincing somebody that they're having a hallucination, I've never noticed that it to be successful. And yes, increasing the light in the room will also help. So Lizzie says, Mom says she's getting where she's having, it's hard for her to swallow. Yes. So actually, I'm going to have Lori, I'm going to read Lori's question real quick, and then Laura can maybe help me with this one. Does a combination of gabapentin and Celexa cause drowsiness? That's a medication question. Laura, can you answer in the comments if gabapentin and Celexa can cause drowsiness? My first gut response would probably be yes. My second response is you can call the pharmacy too and see if the pharmacy can help you with that. But regarding is sleepiness common in late stages Alzheimer's? Yes, people get very sleepy later on. Yes. And then back to Lizzie's question. So Lizzie said it's getting hard for her mom to swallow. So a few things jump out at me regarding that, Lizzie. Number one, I am not a speech language pathologist, but I do know a lot about swallowing. Swallowing is one of the last things to go when people have dementia. It's one of the things that we keep up until the end. Sometimes people need a modified diet. It can be that the diet that she's on is too difficult for her. For example, chewing regular food is hard work. And if we're having a hard time chewing our food to get it all the way fine, then swallowing is hard. Swallowing gets delayed. Some people need to be on a mechanical soft diet. Some people need to be on a pureed diet because they cannot chew it. They can still swallow it, but they can't get it fine enough to swallow. Some people need to be on a thicker liquid, right? So if you think about water, when you pour a glass of water, water is a thin liquid. It just runs quickly, right? So when we take a drink, if we have a delay in our swallowing in our esophagus, then the water can go straight down into our lungs because our body's not responding fast enough. So sometimes people are put on a nectar-thin liquid or a nectar liquid, which runs slower, so it gives our body time enough to respond to the liquid so that it goes down into our stomach and not into our lungs. After a nectar-thickened liquid, the next one up after that is honey. If you think about honey, if you pour honey, if you take a spoon of honey, right, it drips off slower, right? So that's the third level of liquid. And then the one after that is pudding. Pudding is like pudding consistency, and that means we really are not having a good time. We're really struggling to swallow. Like if our liquids have to be pudding consistency, we're having a very hard time swallowing. What I would recommend, Lizzie, is that you need to probably see if you can get a speech therapist involved to see if there's modifications in her diet that you can make regarding slowing things down. There are a lot of the variety of reasons why people are having a hard time swallowing is just as vast as every person with dementia. So, and then Laura asked you, Lori, if why is she taking gabapentin? Is it for pain or neuropathy? So I think having maybe looking at your mom's medication or your loved one's medication. I think it's your husband, right? See, I'm trying to keep track of everybody, but it's kind of hard online when you haven't really, met people face to face. It's easier keeping things contextually, but I think Lori's is her husband, if I remember correctly. But I could be wrong. So yes, I would definitely maybe reach out and, Laura, she said he's in a nursing home. It's through it's limited because of COVID. Thanks for, right. So white of his eyes several times per minute. I'm guessing that's the gabapentin. It might be the gabapentin. Sometimes as people's brains change because of dementia, they can also start to have seizures. So, it's very hard if somebody is in Lori, when somebody has in their later stages of dementia, they have all sorts of stuff start to go on. He could be having, like I said, seizures, or he could be having little mini strokes. It could be medication related. I would question if he's truly in a later stage of dementia, which it sounds like it is based off of our previous conversations that we've had. We need to maybe consider taking him off of medication if he doesn't truly need the medicines. People in later stages, actually anybody an older adult, their liver takes it, the metabolism of medication is very hard for them to metabolize medication, so it builds up in their system. And so he could just be over medicated. And Laura made another comment here, and I absolutely agree with Laura here. Our expectation needs to be more communication in COVID versus less communication. And I'm finding it so difficult right now because I see so many people online saying they're having less communication, and that has to be so frustrating and so scary for people. So, and Laura also said maybe try using email. Tamsin said, my aunt is pushing my mom to get dentures because mom keeps saying she has an infection in her mouth. I don't think she does. Her labs are perfect. I'm so afraid mom will go downhill during recovery and stop eating well. She's in her 4th year of a dementia diagnosis, and I did not switch my phone off. That was embarrassing. I normally switch my phone off, and now it is off. All right. So Tamsin, it sounds like your mom has dementia, right? And you said it's about 4 years. Does your mom live with your aunt, or does your mom live with you? And what does her teeth look like? What do the rest of her teeth look like? Does she have decayed teeth? Or does she have all of her teeth, or are they just falling out of her mouth? Those are a couple of things that I would love to know before I would even say anything about that. If she doesn't, mom. So she does, yes. That's a tough question because dentures take a while for their gums to heal. If there is any way, why does your aunt want your mom to have dentures? Is it a cosmetic thing? I mean, some people, the only reason they wear dentures is because of cosmesis, because of not wanting to, not have teeth in their mouth. So there are all of these questions that I have regarding why doing the dentures. And so I would say they're in her apartment, or she is in her apartment there, and they are not in great shape. Her teeth are not in great shape. Okay. So I would start with just trying to take her to the dentist and talking about it. If there's no infection, mouth care is very, very important. So there are some pros to getting any kind of infection or infected teeth out of people's mouths. A lot of the research nowadays actually is starting to show that when they do autopsies on people with dementia, they're finding the same bacteria for gingivitis and for periodontitis and even things like Lyme disease in people's brains because of the blood-brain barrier being, the organisms getting through. So yes, there is a concern if there is an infection, but there is also a concern if you have to put somebody under with anesthesia or any kind of thing like that to try to take teeth out of their mouth. There are pros and cons to all of that. So I would start with a dentist. I would start talking to the dentist about saying, what's going on in mom's mouth, which is also, a challenge to try to take somebody to the dentist when they have dementia. But if it's only a cosmetic thing, I would be very, very leery about putting her under anesthesia to take teeth out, to get dentures put in, because she probably won't adapt to it. So Lizzie said you gave her some mashed potatoes. I'm going to have to change her diet. So Lizzie, I would start with soft foods. I would start to, prepare normal food the way you would normally and just puree it. Put it in a blender and puree it, and then try to make it, softer, and see if she does better with the pureed diet, see if she'll be able to actually manage that in her mouth. But I would also encourage you, if she's living with you, try to see if you can get home health speech therapy to come out and do a swallowing assessment. That might be an avenue for you to look at as well, just because she could be struggling too with thin liquids, and I don't want it going into her lungs. And if we can prevent her from getting pneumonia, that would be definitely a bonus. So maybe reach out to your physician and say, hey, can we have a home health speech therapy evaluation just for her swallow? Another way of doing it is if you wanted a modified barium swallow study, which means she goes in for an x-ray. They take an x-ray, they give the people various different types of food with barium in, and they actually take a video of their swallowing function to see what's the best constitution of food to go through. But you have to be able to get out of the house, you have to be able to make an appointment, etc. So you have two different, you have a bedside swallow study, and then you have a modified barium swallow study, and then there's some other swallow studies that use some things called it's a fees study, where they go down through your nose with a camera and they take a look as you're swallowing. So speech therapy has a lot of different tools that they can use to help you assess somebody's swallow. So I would start with, if mom's hard to get in and out, I would call the physician. Speech therapy can go into home health services alone. You do not need anything more than an order for a speech language pathology home health evaluation for swallowing. Or you could try to get PTOT and speech involved to come out and try to help you in the house, give you some other strategies, and see if you can do that. Home health is great. I would definitely recommend you look at that if you can. So yeah, I hope that was helpful. And anybody else have any other questions? We've got about 7 minutes or so. My questions on my list of paper is finished, which always amazes me that I can almost talk for an hour without just about dementia. It fascinates me. It really does. So let me go through here and see if I've missed any comments as people are going through here. Let's see. All right. So Laura did make a comment about make the room lighter to prevent shadows. That can help. But we also got to be careful that people are actually getting enough sleep. So, you got to weigh the pros and cons of that. When people don't sleep well, their thinking processes are different. All right, so nobody else has any questions. So yet again, today is Saturday, November the 7th. It is just about noon. My name is Lizette. I'm an occupational therapist and a dementia specialist and consultant. I have my own company where I work on trying to educate people regarding dementia and helping people navigate this process with their loved one. My goal is to try to educate. The name of my company is Think Different Dementia, and the reason I picked that is I want people to think differently about dementia, and I'm trying to educate people as much as possible regarding dementia and how it progresses and so on. I do have a little course that I started that I'm developed for the holidays. I'm hoping to try and get as many people in this course as possible to be able to. I'll get to that. I'll answer that here in a second, Miss Adele. So on how to engage people in meaningful activities during the holiday season, and it has been designed to be able to take somebody all the way from a mild cognitive impairment all the way through end stages of dementia and still try to engage them at the level that they're at with their environment. So I hope you guys will check that out. I have a post up regarding that, and if you're interested, just shoot me a message and I can send you the link to that. So Adele's going to be the last question of the afternoon. Have I any tips on encouraging them to wash and shave, please? So Adele, yes, I do have some tips regarding that. A lot of things that knowing what level a person's at is always easier. Is it just that they're forgetting to wash and shave? Or are you talking about washing their face or actually taking a shower? When people progress through their dementia phases, they really start to lose the ability to sequence even their routine and familiar activities. So expecting them to initiate it on their own may be something that's not reasonable for them anymore. You might have to say, I don't know who your loved one is. Is it a dad, a husband, a brother, whether they live at home alone, whether they live with somebody. But some ways to encourage them is to say, it's time, let's go shave, and go with them. They may need literally step-by-step instructions. Here, wash your face, wet your face. Here, let's warm up your beard. All right, here's the shaving lotion. Let's put it on. All right, let's start to shave. They don't understand the need. They probably don't understand the need, so they're not able to sequence themselves through the task. So you got to ask yourself, okay, is it time? Okay, it's your dad. Is it time to let them grow a beard and just keep the beard trimmed? Is it time to switch to an electric razor? Is it time to do the shaving for them? Is it time for you to step-by-step stand there with them and sequence them through it? If the person doesn't understand that there's a problem, if the person themselves doesn't recognize that there's a problem, for example, I have a full beard, I never used to wear a beard, it's time to shave, then we cannot expect that. If they're not recognizing the problem, we cannot expect them to actually be able to solve the problem without our help. So I would start to say, okay, let's try to see, do we need to sequence them, take them to the bathroom, have everything set up. Here, Dad, it's time to shave. Let me help you, and step by step help them take a shave. Do we need to switch to an electric razor? Same thing though, take them into the bathroom. Here, Dad, here's the razor. Look at yourself in the mirror. Let's shave, and then you be quality control. Regarding showering, there's so much that we can talk about showering. Showering is a very difficult thing, but a very good friend of mine has the philosophy, and she says it's the so what. So what if they don't shower? As long as they're clean, if we can get them clean with sponge bathing, then we do that instead. We don't want bathing to be a battle. But I'll answer that question again next week. I'll talk about bathing again, because that's a... all right, great. So sequence, try that. And reach out and let me know how that goes. We are at an hour. I have thoroughly enjoyed being here. And Lori, I'm so sorry that you missed the clues earlier on. I wish you had known too. But keep asking questions. It's the best way you can learn. It's the best way you know how to help your husband. Marcy, thank you for the comment. I'm encouraging you guys to join my private Facebook group. It's called Think Different Dementia. So please reach out, message me. I'm here to serve you. Let me know what I can do. And I hope you guys have a wonderful Saturday. Blessings, okay? Bye.